Okay, very good. Hello and welcome to the Stony Brook Medicine's Healthy Library Programs webinar. This webinar will be discussing COVID-19, cardiovascular disease, and respiratory issues. Today our webinar features 3 faculty members from Stony Brook University, nursing students and also public health students. My name is Mary Ellen LaSala and I am the chair of the Department of Undergraduate Studies in the School of Nursing. The other 2 faculty members that will be participating today are Carol Delarada, Associate Dean for Academic Affairs and Strategic Partnerships in the School of Nursing. And we also have Stephen Smith. He is faculty in the Respiratory Care Program. The students will introduce themselves before they begin presenting today. Next slide.
A little bit about our Healthy Libraries program. This was a partnership that was formed between the Suffolk Library Cooperative System and the health profession schools at Stony Brook University. We also received a grant from the American Heart Association. And so the students are on an interdisciplinary team and they belong to schools in the public health, Masters of Public Health program, nursing program, respiratory care program, and social work students. And our aim is to provide evidence-based health information, screening, and case management to patrons in the public library system. And since the libraries are closed, we are now providing information virtually. We also, a second aim is to refer patrons to promote access to appropriate care and social services programs locally that will address both their health and their social support needs. And then a final aim is for our students to experience working on an interprofessional team.
So we have a lot of information to go over today. And this includes, what is COVID-19 and how does it spread? Who is at risk for COVID-19 and what are the symptoms? How can the spread of COVID-19 be prevented? What are the personal behaviors needed to help combat COVID-19? Why is testing important and where can you find testing sites? What is telehealth and how can you find telehealth providers? We also will be discussing guidelines for those with cardiovascular and respiratory diseases. And lastly, what resources are available for COVID-19 for cardiac and respiratory diseases?
Hi, I'm Sherry, and I'm a nursing student at Stony Brook University, and I'm graduating this May. So what is COVID-19? COVID-19 is a respiratory illness that can be spread from person to person. The SARS-CoV-2 is the virus strain that causes the COVID-19 illness. This particular strain belongs to a family of viruses called coronaviruses. This is the 3rd novel coronavirus to emerge in this century. The previous 2 novel coronaviruses were SARS, which emerged in 2002, and MERS, which came about in 2012. Scientists have used the history and research from these previous viruses in order to gain a better understanding of this new virus that causes COVID-19. Here's a video that goes into further detail about what this new coronavirus is.
Can anybody hear the video?
No.
I'm not hearing it either. Gabriella?
Viruses that cause sicknesses like the common cold,
Great.
as well as more severe diseases such as Middle East Respiratory Syndrome or severe acute respiratory syndrome. A novel coronavirus is a new strain, one that has not previously been recognized in humans. Coronaviruses cause diseases in mammals and birds. A zoonotic virus is one that is transmitted between animals and people. When a virus circulating in animal populations infects people, this is termed a spillover event. It is speculated that the 2019 novel coronavirus, or COVID-19, originated in bats and was transmitted to humans, possibly with pangolins as an intermediate host. Unfortunately, COVID-19 is now spreading from human to human as well. COVID-19 has surpassed the SARS death toll in a matter of weeks. Even though the death rate is much lower, it spreads faster. Early data suggests that in around 82% of cases, symptoms are relatively mild. The illness begins and ends in the lungs. However, the remainder of cases are severe or critical, typically in older or immunocompromised individuals. How does COVID-19 affect the body? The virus is fitted with protein spikes sticking out of the envelope that forms the surface and houses a core of genetic material. Any virus that enters your body looks for cells with compatible receptors, ones that allow it to invade the cell. Once they find the right cell, they enter and use the cell's replication machinery to create copies of themselves. It is likely that COVID-19 uses the same receptor as SARS, found in both lungs and small intestines. It is thought that COVID-19 shares many similarities with SARS, which has 3 phases of attack: viral replication, hyperreactivity of the immune system, and finally, pulmonary destruction. Early on in infection, the coronavirus invades 2 types of cells in the lungs: mucus and cilia cells. Mucus keeps your lungs from drying out and protects them from pathogens. Cilia beat the mucus towards the exterior of your body, clearing debris, including viruses, out of your lungs. Cilia cells are the preferred hosts of SARS-CoV and are likely the preferred hosts of the new coronavirus. When these cells die, they slough off into your airways, filling them with debris and fluid. Symptoms include a fever, cough, and breathing difficulties. Many of those infected get pneumonia in both their lungs. Enter the immune system. Immune cells recognize the virus and flood into the lungs. The lung tissue becomes inflamed. During normal immune function, the inflammatory process is highly regulated and is confined to infected areas. However, sometimes the immune system overreacts, and this results in damage to healthy tissue. More cells die and slough off into the lungs, further clogging them and worsening the pneumonia. As damage to the lungs increases, stage 3 begins, potentially resulting in respiratory failure. Patients that reach this stage of infection can incur permanent lung damage or even die. We see the same lesions in the lungs of those infected by the novel coronavirus as those with SARS. SARS creates holes in the lungs, so they look honeycomb-like. This is probably due to the aforementioned overreactive immune response, which affects both healthy and infected tissue and creates scars that stiffen the lungs. As such, some patients may require ventilators to aid breathing. The inflammation also results in more permeable alveoli. Alveoli are the location of the thin interface of gas exchange, where your lungs replace carbon dioxide in your blood with fresh oxygen you just inhaled. Increased permeability causes fluid to leak into the lungs. This decreases the lung's ability to oxygenate blood, and in severe cases, floods them so that you become unable to breathe. Sometimes this can be fatal. The immune system's overreaction can also cause another kind of damage. Proteins called cytokines are the immune system's alarm system, recruiting immune cells to the infection site. Overproduction of cytokines can result in a cytokine storm, where there is large-scale inflammation in the body. Blood vessels become more permeable and fluid seeps out. This makes it difficult for blood and oxygen to reach the rest of the body and can result in multi-organ failure. This has happened in the most severe cases of COVID-19. Although there are no specific treatments for coronaviruses, symptoms can be treated through supportive care. Also, vaccines are currently in development. So, what can you do to protect yourself from COVID-19? Advisories vary in different countries, but the basic protocol comes down to regular hand washing, avoiding close contact with anyone coughing or sneezing, avoiding unnecessary contact with animals, washing hands after contact with animals, thoroughly cooking meat and eggs prior to consumption, and covering your mouth and nose while coughing or sneezing. Respiratory viruses are typically transmitted via droplets in sneezes or coughs of those infected, so preventing their travel stops the spread of disease.
Coming soon. Should you wear a mask? And if so, what
So we also have another video below that provides even more information about COVID-19. This PowerPoint will be posted to the library website after the presentation if you wish to view this video as well. Who can get sick? Anyone can get sick. This virus has the ability to affect any age group. There have been cases reported in all 50 states. As of April 28th, 2020, there have been 981,200 in the U.S. New York State has the highest rate with 287 cases and 20 COV and serious disease, hypertension, and people with chronic respiratory symptoms have a greater chance of experiencing serious complications. Next. So this is a graph from the CDC that reports the rates for hospitalizations due to COVID-19 as of April 17th, 2020. It is based on rates per 100,000 people and is separated by age groups. As you can see, the higher hospitalization rates start around age 50, with most hospitalizations being those who are 85 and older. With the implementation of social distancing, New York State hospitalization rates began stabilizing, and it has now even been showing that the hospitalization rates have been trending downward. How does it spread? The virus is thought to be spread mainly from person to person. It is spread between people who are in close contact with one another. Officials are saying within about 6 feet. It can also be spread through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Some recent studies have suggested that the virus may be spread by people who are not showing any symptoms. It also may be possible that a person can get the virus by touching a surface or object that has the virus on it and then touching their own mouth, nose, or eyes. This virus is spreading very easily between people. Information from the ongoing COVID-19 pandemic suggests that the virus is spreading more efficiently than the influenza virus, but not as efficiently as measles, which is highly contagious. Next. Symptoms. Reported illnesses have ranged from mild symptoms to severe illness and even death. Symptoms may appear anywhere from 2 to 14 days after exposure. This is an estimate based on the incubation period of the MERS-CoV virus. Main symptoms include fever, cough, and shortness of breath. The CDC recently added new symptoms to look out for as well. These include a severe headache, repeated shaking with chills, muscle pain, sore throat, and a new loss of taste or smell. The CDC has stated that if an individual has at least 2 of these new symptoms, that they may have been infected with the virus. Emergency warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion or the inability to arouse, and bluish lips or face, which can indicate insufficient oxygen circulating the body. If a person is reporting any of these emergency warning signs, they should seek medical attention immediately. Primary prevention involves cleaning your hands often. You should wash your hands frequently with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, you can use a hand sanitizer that contains at least 70% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with others. Remember that people may not show symptoms, but may still be able to spread the virus. Social distancing is especially important to those who are at a higher risk, such as the immunocompromised, those with heart disease, hypertension, diabetes, and respiratory compromise. People should stay home as much as possible. Remember, even if you don't feel sick, it does not mean that you do not have the virus. And if you do have the virus, you can still spread it to other people, even while being free of any symptoms. Please make sure to cover coughs and sneezes. If you do have to cough or sneeze, it should be done into a tissue or into the inside of the elbow. You should throw away used tissues immediately. You should clean and disinfect all frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. You can use detergent or soap and water prior to disinfection. Here's a video on how to properly wash your hands.
I want to send a big thank you to my daughter, Jenna, who's a nurse in the ICU.
For all you do, Shelley. Thanks.
You know that the best way to prevent the spread of coronavirus is to wash your hands.
Wash your hands.
Wash your hands! But why? It's because soap, regular soap, fancy honeysuckle soap, artisan peppermint soap, just any soap, absolutely annihilates viruses like the coronavirus. Here's how. This is what a virus, like coronavirus, looks like. It's a bit of material surrounded by a coating of proteins and fat. Viruses easily stick to places like your hands, but when you rinse your hands with just water, it rushes right over the virus. That's because that layer of fat makes the virus behave kind of like a drop of oil. You can see it happening in this demonstration. Oils are just liquid fats. What happens when you pour oil into water? It floats. It doesn't mix. But add soap, and suddenly that fatty oil dissolves into the water. That's because inside, soap has two-sided molecules. One end of the molecule is attracted to water, the other end to fat. So when the soap molecules come in contact with water and fat, these dual attractions literally pull the fat apart, surrounding the oil particles and dispersing them through the water. Let's go back to our coronavirus molecule with that layer of fat holding everything together. When it interacts with soap, bam, that fat gets pulled out by the soap. Soap literally pulls apart and demolishes these viruses. And then the water rinses the harmless leftover shards of virus down the drain. But, and you know where I'm going with this, it takes time for this effect to happen. 20 seconds to be specific. To show why, we ordered this lotion that mimics viruses and their fatty layers. It glows under a UV light. If you just rinse your hands under regular water, nothing comes off. If you wash with soap for just 5 seconds or 10 seconds, your hands are still covered. The virus is still there, able to get you and others sick. But 20 full seconds, now the soap is actually destroying the virus. Hand sanitizer works too because it's mostly alcohol, and alcohol works in a somewhat similar way to soap, breaking down that fatty layer. You need a high concentration of alcohol to make that work. The CDC recommends hand sanitizers with at least 60% alcohol. But even with 60% alcohol, the CDC recommends using soap if you can. If your hands are sweaty or dirty when you use the sanitizer, that can dilute it and diminish its effectiveness. As for soap, just any old soap works. You don't need soap marketed as antibacterial even. The FDA says skip it. There's no proof it's any more effective. Just be sure to wash your hands for 20 seconds. That's happy birthday twice.
Happy birthday, dear. I guess me.
Or the chorus to Lizzo's Truth Hurts.
Straight to my face.
Or Prince.
Raspberry beret.
Or Eminem.
Go, go, only got.
Or even Dolly.
Jolie, Jolie, Jolie.
Just as long as it's 20 seconds. And you're using the ultimate virus annihilator, soap.
So as you can see, this is extremely important because knowing how to properly wash your hands can help save lives. If you must go out into the public, for example, to the grocery store or the pharmacy, you should wear a cloth face cover. As of April 15th, 2020, New York State Governor Andrew Cuomo has issued an executive order mandating that all people in New York State wear masks or face coverings while out in public. These masks should fit snugly but comfortably against the side of the skin. They should be secured with ties or ear loops. They should include multiple layers of fabric. It is very important that you are able to breathe while wearing the mask. The mask should be able to be washed after every use. Cloth face coverings should not be placed on young children under the age of 2, on anyone who has trouble breathing, or on anyone who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. This face cover is meant to protect other people in case you are infected, not necessarily to protect yourself from obtaining the virus. Do not use a face mask that is meant for a healthcare worker. There is a critical shortage of masks, and these should be reserved for healthcare workers who are treating the sick. Even with the mask on, you should continue to keep 6 feet between yourself and others. These face masks are not a substitute for social distancing.
Hi, my name is Brianna, and I'm also an undergraduate nursing student. So why is testing important? COVID-19 testing remains critical. Testing leads to quick identification of cases, quick treatment for those people, and immediate isolation to prevent spread, quick identification of anyone who came into contact with infected people so they too can be quickly isolated. Testing also will help us develop a full picture of the progression and spread of this disease. So now we'll talk about the types of COVID-19 tests. There are 2 types of tests. In the less intrusive test, a saliva sample is taken from the back of the throat using a cotton swab. A nasal swab can also be obtained. This helps diagnose current cases, but cannot tell if someone had the infection and recovered. The Wadsworth Center's antibody test for SARS-CoV-2 detects antibodies which are produced by your own immune system to fight off the virus. Antibodies are present in anyone who has recovered from COVID-19. This is useful for patients with mild or no symptoms and can detect someone who has recovered. Next. So where can you get tested? Stony Brook University offers free drive-through testing 7 days a week from 7 a.m. to 7 p.m. Appointments are required. Testing is also free to all eligible New Yorkers as ordered by a healthcare provider or by calling the New York State COVID-19 hotline at the number provided on the screen. You can also fill out a COVID-19 online assessment to share your symptoms and pre-register for testing at the link provided.
Hi, I'm Steve Smith. As previously noted, I'm a professor in the School of Health Technology and Management Respiratory Care Program. And I'm going to spend a few moments talking about those who have lung disease. People with serious underlying health conditions, such as lung disease, which can include asthma, COPD, chronic obstructive pulmonary disease, lung cancer, pulmonary fibrosis, or cystic fibrosis, are not more likely to contract the disease, but are more likely to develop more severe symptoms if they get infected. The lungs are the first and main body organ affected by COVID-19. The virus rapidly invades cells in the lungs, causing inflammation and breathing problems. It is thought to attack the cells lining the airways. And as a result of that, the lung becomes severely damaged, which could eventually lead to respiratory failure or adult respiratory distress syndrome, or ARDS. And patients who develop ARDS are more likely to end up on mechanical ventilation and higher concentration of oxygen. And if the disease continues to progress and get worse, it could lead to more organ failure and potentially death. There is a very interesting video on coronavirus in the New York Times. You can certainly take a look at it at your own leisure, but it will help you to determine how to best prevent the spread of coronavirus. Along with that is the American Lung Association. They have a helpline and the number to answer any questions regarding COVID-19. And that number is 1-800-LUNG-USA. Again, 1-800-LUNG-USA. For those with asthma or COPD, it is highly recommended that you continue to take medications for any asthma, COPD, or any lung disease. Having a poorly controlled chronic condition puts individuals at risk for severe illness. If running low on medications, it is highly provided that you contact your healthcare provider and see if your insurance company will provide up to a 90-day supply. The CDC recommends, if you do have lung disorders, to have at least a 2-week supply available of your medications. If you have an option in your insurance company policy where you can order your medications through a mail order pharmacy, that is highly recommended. One of the most important factors in decreasing complications is keeping your lung disorder, such as asthma, in well controlled. And that recommends compliance with your medications. If you use a nebulizer at home and take treatments, medication nebulizer treatments, follow the manufacturer's suggestions in keeping that medication nebulizer clean and in good working condition. And I recommend that you have a second backup nebulizer in case the one you have breaks. Anyone with a compromised immune system should be especially stringent on staying home and practicing preventative measures. And that includes, as you saw the video previously, hand washing, keeping your social distance, and if you go outside, wear a mask. Contact your health provider to determine an individual plan of action for your particular lung disease. If you're at home on oxygen, keep your equipment clean. Have extra equipment available in case anything breaks. If you're using an oxygen concentrator, make sure that the concentrator is serviced regularly, that the filters are changed routinely, and that the provider maintains that equipment in good working order. Other lung factors. If you smoke or you vape, it's certainly, according to the literature, is heavily linked to lung inflammation, and it reduces lung and immune function. In fact, prior to this pandemic, there was incidences during 2019 where young people who were vaping ended up in the intensive care unit because of the toxic inflammation of the airway caused by vaping. So I strongly recommend, if you smoke, try to stop smoking and don't vape. It will only enhance the COVID-19 if you become infected. If you live in areas of poor air quality, be sure to stay inside. Right? It is indicated in air quality areas, air pollution can make COVID-19 even more worse than originally thought. Since it is a disease affecting lungs, people who live in places with more pollution become more vulnerable. There's a link number address below to the American Lung Association. If you want more information on COVID-19, they're providing webinars, and from what I understand, they're going to be providing future webinars on those with lung disease and caring for themselves who contract COVID-19.
Okay, so now I'm going to talk about cardiovascular disease and hypertension. So for those with cardiovascular disease, the American Heart Association is advising caution and preparation for people who have heart disease or who have survived a stroke. What this means is that if you have cardiovascular disease, such as coronary artery disease, hypertension, heart failure, or have suffered a stroke, you're at high risk for developing more severe symptoms of COVID-19. The American College of Cardiology issued a bulletin to warn patients about the potential increased risk. In the bulletin, they stated, the virus's main target is the lungs, but it could also affect the heart, especially a diseased heart, which has to work harder to get oxygenated blood throughout the body. This could exacerbate problems for someone with heart failure where the heart is already having problems pumping efficiently. Someone with an underlying heart issue also might have a less robust immune system. People's immune systems weaken as they age. And in those with chronic medical conditions, the body's immune response is not as strong a response when exposed to viruses. According to the American College of Cardiology, a virus may also pose a special risk for people who have fatty buildup known as plaque in their arteries. Evidence indicates that viruses similar to the SARS-CoV-2 can destabilize these plaques, potentially resulting in the blockage of an artery, feeding blood to the heart, putting patient at risk for a heart attack. There are actions you can take. The recommendations for people with cardiovascular disease are mainly to adhere to the standard precautions, which are hand washing, social distancing, use of face masks, and covering coughs and sneezing. It is also important to continue with all the normal recommendations for heart health. So physical activity, healthy eating, and managing stress, which will be discussed more in depth later on in the presentation. So for those with hypertension, early findings suggest that high blood pressure could raise your risk of getting the coronavirus in older adults. It could also raise the risk of experiencing severe complications from the coronavirus regardless of age. Nearly half of the US adults have high blood pressure or hypertension, which is defined as consistent readings of 130/80 or above. Data from the initial COVID-19 outbreak in Wuhan, China shows an overall mortality rate of about 2% among patients with the virus. In contrast, however, the mortality rate was 6% in patients with high blood pressure. The rate was also elevated for people with diabetes, cardiovascular disease, chronic respiratory disease, and cancer. So prevention is the best defense. If you have high blood pressure or any underlying condition, it is especially important to follow recommendations about social distancing, hand washing, and of course, other practices that can prevent COVID-19 spread. You want to always follow medical advice from your healthcare provider. Patients taking common types of blood pressure medicines who contract COVID-19 should continue treatment unless otherwise advised by their physician. Patients should consult with their healthcare provider before changing treatment strategies. Some medical offices are offering virtual or telemedicine visits. People should avoid high blood pressure hazards. These include over-the-counter medications like nasal decongestants and painkillers called NSAIDs, such as Motrin, Aleve, Advil, which can raise your blood pressure. People with heart concerns should limit or avoid them. Some prescription drugs, such as corticosteroids, oral birth control, immunosuppressants, mental health drugs, and cancer medications can affect blood pressure as well. Patients on these medications should monitor their blood pressure frequently. Alcohol and caffeine should also be limited. Some herbal supplements such as licorice can raise blood pressure. Foods such as cured meats can also raise blood pressure, as well as interact with some antidepressants. It's important to try to manage your stress because stress can lead to bad habits such as poor diet, which can increase the risk of developing high blood pressure. Patients with chronic hypertension should have extra medication on hand. Mail order prescriptions might help people stock up on medication so they can stay inside. People with hypertension should be able to also recognize the signs and symptoms of a blood pressure emergency. A hypertensive crisis occurs when blood pressure rises quickly. The readings can reach levels of 180/120 or even greater. Other symptoms of hypertensive crisis include chest or back pain, numbness or weakness, loss of vision, and difficulty with breathing or speaking. These patients should seek immediate medical attention.
Hi, my name is Stacy Plasky, and I'm also graduating from Stony Brook University in the nursing program this spring. So we're going to somewhat switch gears now and talk about how you can keep your immune system healthy. So your immune system is the #1 line of defense, and prevention is our best defense. So in addition to staying home, I'm just going to reiterate everything that everyone has already said today. We want to make sure that we are diligent about our hand washing regularly and effectively. Social distancing when you do have to go out, like Sherry said, to the pharmacy or the grocery store, or even for a walk in nature, you want to make sure that you wear your cloth mask. But again, please stay home as much as possible. Exercising, eating healthy, getting plenty of rest, and keeping your stress level as low as possible are all ways to keep your immune system in tip-top shape. And we're going to talk a little bit more about that now. So stress reduction, yoga postures, and yoga breathing. Practicing yoga as part of an overall healthy lifestyle can help lower blood pressure, increase lung capacity, improve respiratory function, improve balance, boost circulation, tone your muscles, and most importantly, can give you an overall sense of well-being while building strength. If you're affected by lung disease such as COPD, asthma, or lung cancer, there are safe exercise options for patients who have difficulty breathing. Of course, you always want to make sure that whatever exercise program you uptake, that you're under the guidance of a respiratory therapist or your healthcare provider. Through gentle breathing-based exercises, such as Tai Chi, yoga pranayama, you can improve your physical strength and promote emotional well-being. These practices not only improve lung health and capacity, but can also help us cope with stress anxiety, and depression that unfortunately sometimes accompany a lung disease. Check with your local library to see if they offer any yoga classes. Next slide. So meditation, which is also a part of yoga and stress reduction. Recent studies have offered promising results about the impact of meditation in reducing blood pressure. There's also evidence that it can help people manage insomnia, depression, and anxiety. Some research suggests that meditation physically changes the brain and can help with increasing our ability to process information, slow the cognitive effects of aging, reduce inflammation, support the immune system, and we'll star that one, reduce symptoms of menopause, control the brain's response to pain, and improve sleep. There are many types or methods of meditation which are effective. Different methods will appeal to different people, but the end result is the same, a calmer and clearer mind, which has extremely positive effects on overall health and well-being. It could be as simple as sitting quietly and focusing on your breath. When your mind wanders, as it will, especially in stressful times like now, we can gently bring our attention back to our breath again and again. You can gradually increase the amount of time you're able to stay focused each day. Even 5 minutes a day, sitting quietly and focusing on your breath will make a big difference in how you feel and your overall outlook. If you're not sure how to get started, you can look for free online meditation classes, get recommendations from friends, or again, ask your local library if they are offering any upcoming yoga and meditation classes on their schedule. So gratitude. How can gratitude help our immune system and help to support our overall immune health? So research indicates that the practice of gratitude can have dramatic and lasting effects in a person's life. It can lower blood pressure and improve immune function. Grateful people engage in more exercise, have better dietary behaviors, are less likely to smoke and abuse alcohol, and have higher rates of medication adherence. So this is a very challenging and scary time for people all over the world. Employment and money concerns, health concerns, losing friends and family members to COVID-19, as well as social distancing. All of these stressors have the potential to affect us in many negative ways. We would like to offer an additional perspective that there can be opportunities for us to reevaluate our lives, our relationships, and our health during this downtime. We can utilize this time to have meaningful connection with people in our lives that we care about, who we may not normally have enough time to connect with the way that we'd like to. We can also use this time to get outside in nature more, read books, work on projects around the house, or maybe even pick up a new hobby. So here are some questions you can ask yourself each day, and you can do this when you first wake up in the morning or before you go to bed at night or any time during the day, quite frankly. So from a health perspective, what did your body do for you today? And from a nutritional perspective, what did you feed your body to nourish yourself? What did you do that really helped, that you really enjoyed? So an activity, maybe that's playing Scrabble or getting outside with the kids and playing a game, but something that just makes you feel happy. Your relationships, who did you look forward to seeing to or speaking to on the phone? And time, what are you doing right now? So again, journaling, writing this down can be very helpful. And again, first thing in the morning or before you go to bed at night, it can really shift your overall outlook on your entire day. Okay, eating healthy. So we literally are what we eat. What are benefits of eating healthy? Eating a heart-healthy diet is important for managing blood pressure and reducing our risk of heart attack, stroke, and other health threats. So getting quality nutrition from healthy food sources is always important, but especially during times when we want to keep our immune system boosted. So we want to aim to eat a diet that's rich in fruits, vegetables, whole grains, low-fat dairy products, skinless poultry and fish, nuts and legumes, and non-tropical vegetable oils. So all of these food groups that I just mentioned are wonderful because they have lots of antioxidants, fiber, plentiful water content, and heart-healthy fats. All of these will help to sustain our energy and boost our immune system. These are also all whole, real, and unrefined foods. We want to be sure to limit saturated and trans fats, sodium, red meat, and if you do eat red meat, make sure to compare labels and select the absolute leanest cuts available. And we also want to make sure to limit sweets and sugar-sweetened beverages. Okay, so here are some posters that you can look at again after the presentation. There's a lot of great information here. These are resources for healthy eating to be reviewed at your leisure for when you do your next grocery shop run, with your mask on, of course. They are emphasizing the importance of eating a variety of colorful fruits and vegetables to be sure you are getting a variety of nutrients. Staying active. So the American Heart Association's recommendation for overall cardiovascular health, you want to make sure to get at least 30 minutes of moderate aerobic activity, like walking, at least 5 times per week for a total of 150 minutes. And moderate to high intensity muscle strengthening activity at least 2 days per week for additional health benefits and for strength. There are free online exercising classes like yoga and Pilates and different types of calisthenics that you can also look into. For lowering blood pressure and cholesterol, an average of 40 minutes of moderate aerobic activity like walking 3 to 4 times per week is very effective. And at-home exercises can also be found on the American Heart Association's website, and the link here is provided for you. Some other ideas would be riding your bicycle, swimming, or even I think that We program has like a very fun dancing program that really gets your heart rate up quite well.
So hi, I'm Celesta. I'm a graduate student in the public health program at Stony Brook University. So we really want to stress how important it is to continue prevention and primary care through telehealth. Telehealth is the use of electronic information and telecommunications technologies to support long-distance clinical health care, education, public health, and administrative services as well. It's really a broad term that encompasses many different digital health technologies, and it's a method of care delivery that has the potential to reduce costs and increase quality, patient-centeredness, and patient satisfaction. So with recent concerns about social distancing and the spread of COVID-19, you can get care from a clinician right from your home. There are several ways to get care remotely. So either through online consultation, video calls, and even text. So you can use your phone, tablet, or computer to receive this virtual care. You want to connect with a physician for your concerns and questions about COVID-19 to really address any symptoms you may be presenting. It's also really important to connect with your primary care physician for non-urgent care, mental health, and other needs that you may have. This is a list of telehealth providers. There's New York Presbyterian, City MD, and NYU Langone. This is not a comprehensive list by any means. There's also Stony Brook Hospital offers telehealth services, Mount Sinai. There's also Teladoc. So we listed these 3 here. These are urgent care telehealth providers. So for example, New York Presbyterian, they treat various conditions, including cold and flu symptoms, rashes, eye infections, minor cuts and scrapes, so things along those lines. So we've linked these three here if you're interested, but also reach out to your healthcare provider to inquire about telehealth services. We also want to emphasize to please go to the ER if you need to. If you experience life-threatening conditions such as a heart attack or stroke, please do not delay seeking emergency help out of fear of contracting the virus in the hospital or being worried about adding additional strain to the medical team. Under no circumstance should you avoid going to an emergency room or calling 911 if you have serious symptoms, whether they're related or unrelated to COVID-19. So these serious symptoms could include heavy bleeding, deep wounds, severe burns, injury to the head or neck and the spine. Also, if you experience symptoms associated with a heart attack or stroke, which I'll go into more in the next slide, or really any serious symptoms, please go to the emergency room or call 911. Every minute that you delay, the likelihood of you having a worse outcome increases. If you feel that a condition does not require emergency care but can't be treated through telehealth services, you might want to consider going to an urgent care facility. These are same-day clinics that can handle a variety of medical problems that need to be treated right away but are not considered true emergencies, such as minor injuries, minor infections, wounds, and fractures. So these are common heart attack symptoms. So common warning signs include lightheadedness, nausea or vomiting, jaw, neck or back pain, discomfort or pain in the arm or shoulder, pain or discomfort in the chest, and shortness of breath. So we also wanted to note that men and women can experience different heart attack symptoms. The most common symptom of a heart attack for both men and women is chest pain, but women may experience less obvious warning signs. So for men, the warning signs that I just mentioned are typical for them, but for women, they can experience extreme fatigue, indigestion, fainting, pain or pressure in the lower chest or upper abdomen, chest pain, but not always, and also jaw, neck, or upper back pain. These are common stroke symptoms from the American Heart Association. So if you experience face drooping, arm weakness, or difficulty with speech, it's really important that you call 911. We also want to emphasize that we're all in this together. With the enforcement of social distancing, it's really easy to feel lonely, and it can be especially difficult for those who experience mental health conditions. So we will get through this together, and while we are physically distanced, it's important to stay connected socially. So here are just a few ways that you can stay connected to others. You can hold virtual gatherings to stay in touch with friends and family. You can virtually work out with others. You can even take a free online course. So we've linked a website called edX. They have a variety of courses that you can take. You can even play games on your phone or online with friends. So just please remember that you're not alone, and please reach out for help if you really need it. You can also stay connected to others by joining the American Heart and Stroke Association's support network. This is through the American Heart Association. We've linked it here if you're interested. It's just really a good way to stay connected with others, share your experience. You can seek and receive support. You can visit different forums and read personal stories. And if you have any questions, you can get answers from healthcare professionals. The American Lung Association also has a support network that we've linked here. And they also have a helpline. So if you have any questions about COVID-19, you can call. We've also listed additional community resources, such as Stony Brook Medicine Coronavirus information, the National Domestic Violence Hotline, filing for Medicaid, things like that. We also listed mental health resources, different hotlines here. We've also listed food assistance resources. So if you're interested in getting SNAP or WIC, Island Harvest. More resources, financial assistance and housing resources. And I think do we have another one? No, that's it. So yeah, thank you.
All right. I just want to thank all the faculty and the students for a wonderful, informative presentation. Now, I'd like to open it up to questions for our participants. If you have any questions that you'd like to ask the team. Just make sure you unmute your microphone so that we could hear you. Okay. Margaret, Daisy, P. Green, any questions?
No, not really, but very informative, and I can't wait to go back and look at it again.
Great, great. Thank you. Thank you. And Gabriella, I'd like to give a special thank you to Gabriella, who organized this whole webinar and helped get the presentation together. Kudos to you. And do you want to speak about the survey, Gabriella?
Yeah, so I'm going to send a link. It's to an online survey, and
I think someone has a question.
Question, yes.
And the survey just asks questions about how you thought the presentation was, and if there was anything else that you wanted us to include in the survey. It's just feedback for future webinars that we would be doing. So if you could please fill it out. It should take about like less than 5 minutes to complete, and it's linked in the chat box.
Thank you, Gabriella. Margaret, did you have a question? Okay, let's see.
It looks like she's muted.
Yes.
She put a,
there she goes.
Can you tell me what is the point of getting tested if you might have the virus and still test negative?
All right, who would like to answer that?
So I think with virus testing, there's two different types of tests. So the first types of tests, which are the nasal oral swabs and the saliva tests, those test for if you have the presence of the virus currently. So that would be if you were really sick, someone who has the virus in you and you may not show symptoms. And when you're tested at that point, that kind of tells you that you need to social distance yourself and take extra precautions because you could get more sick. There's a second type of testing, which is new, and that's the test for antibodies. And that tests to see if you've had the virus and recovered. And so that test is really important for all of like epidemiologists, public health workers, kind of the government, to know how many people have been infected and how we should proceed with the precautions we take in the future. But it'll also tell you that in the future, if you encounter the virus, your body might have a little bit of more immunity and might be able to fight it because you've already recovered from the virus. So both of the tests are very helpful, and yeah.
Thank you, Gabriella. Dr. Delarada?
Yes, with any test, there may be a false negative. And so if someone has symptoms and their COVID test is negative, they should still consider themselves that they have it, and take, of course, those precautions as far as social distancing, and then also contacting your provider if you feel worse. It says if you have no symptoms and test negative, then it's pretty safe to go back to work or whatever. So most places have policies as far as when you can return to work. And so if you have no symptoms and you test negative, as a healthcare worker, we're returning to work. You know, we're permitted to return to work as long as we don't have a fever. I'm not sure, do you have a specific where the person is returning to work?
I also think that if you have no symptoms and you test negative, that just means that you don't have the virus. And if you test negative for the antibody test as well, that means you won't have recovered from the virus, so you'll have no immunity. So if you are an essential worker, you could still work, but you're going to want to take the necessary precautions of wearing a mask, social distancing, and staying 6 feet away, and hand washing. And if you don't have soap or water available, then using a hand sanitizer with 60% alcohol content or higher.
Great.
Very good.
Professor Steve Smith, do you have anything to add?
No, I thought it was very well done. Extremely well done. Congratulations to the nursing students. You guys did a great job.
Good.
Thanks, Stephen. Margaret also just commented, she said, I guess I'm just thinking of the meat packing folks and the like.
Good question, Margaret.
A great question.
That's a good question and needs to be answered, not in the far distance future, that's for sure. I know that a lot of the places that have meat packing facilities, I think the number of people have been infected well into the thousands. So opening them up again is certainly endangering the personnel in those facilities. So I don't know what precautions those facilities are going to be taking. I heard that the CDC last night, they didn't require suggestions or require the recommendations. Normally the CDC enforces the recommendations. So it's interesting how they're approaching this now. So I don't know what the end result is going to be, but it's kind of scary what's happening to those folks out in those areas.
Yes.
It'd be nice if they could stay home and take a break.
Right. And close down.
Yeah.
And close down.
But Margaret, stay tuned because I'm sure we'll be hearing a lot more today and tomorrow about this. The little that I saw today, Tyson was on speaking, and yeah, I think we'll be hearing much more in the next few hours and the next day of what's going to be happening.
Yeah, I totally agree with that, Miriam.
Yes. Thank you, Margaret.
Thanks, Margaret.
Oh, thank you. Thank you. So proud of everyone.
Yeah, great job, guys.
Yes. Okay, Dr. Ben Scott, would you like to add anything?
Hold on.
Okay.
Wait a second. Unmute.
Okay. We hear you.
Oh.
Yes. We hear you.
I didn't realize you could hear me. I'm so sorry.
Yes, that's
You heard
okay.
me yell
We
at my
hear
daughter?
you. No, we did not hear that. No.
Oh, I'm so sorry. I thought you did an outstanding job. I'm so impressed by how you weaved all the different themes and the expertise of everyone involved. Special shout out to my colleague in respiratory therapy, Steve Smith. Thank you.
Thank you, Lisa.
You know, Steve, this means we're pulling you in. This is just the beginning.
I got that feeling from Gabriella.
And I have so many other ideas, Steve, too. So get ready.
Okay.
Get ready.
So I think it would be ideal, as we've talked about, to provide these materials in Spanish and be able to push that out. And we do have people who, if folks who are.
Jessica, do you have any questions? Would like to add anything?
Where am I?
Good, you're here. You're here. Hi, Jessica.
Hello, can you hear me?
Yes.
Oh, okay. No, I just thought it was a very good presentation.
Right.
You know, a lot of things are changing too, day by day, in terms of the research that's backing up these claims. And I think that everyone did a really good job of addressing what's very current right now.
Good. Thank you, Jessica.
Thank you.
Okay. I guess we will end the webinar, and thank you to all.
Thank you.
Thank you.
Bye-bye.
Thank you, everybody. Thank you very
Bye.
much.
Be safe.
Okay, you too.